look at the blood vessels and their flow through them as far as the blood is concerned, and to look at the blood pressure and how we maintain that and how it is affected by changes in the blood vessels themselves. So when we look at blood vessels and we think about the flow of the blood through them, we obviously know that the heart is essentially at the heart of the situation. And so blood is forced into the blood vessels through the heart. And as it does so, it's going to push that blood into the vessels to begin with. And then we have the aortic valve and the pulmonary valve blocking its return back to the heart. So it's got nowhere to go except for away from the heart. And as blood moves away from the heart, it's going to get a lower and lower pressure the further away from the heart that it goes. And so as it's moving through all of the miles and miles of blood vessels, that pressure and the amount of blood that's in a given blood vessel is going to decrease over time. So blood vessels themselves have a couple of different things that are going to increase the or change the way that blood flows through them. And the first of which here is resistance. And so resistance is going to be a big component. And so this is essentially, think about it as kind of being like the resistance if you were walking down a hallway. The more people that are in the hallway, or the smaller that the hallway is, the more narrow the walls are in towards one another, the slower everybody has to move, because essentially everybody's going to be bumping into one another, and so there's going to be more friction there. And the same thing goes for blood vessels. And so the vessel diameter, as we get a smaller and smaller diameter, oops, that one got a little bit bigger, the amount of friction is going to increase. So our friction increases as we get a smaller and smaller diameter along the way. So smaller diameter equals more friction equals more resistance for the blood to flow through it. The next thing that affects our resistance is the length. And so a shorter blood vessel is going to have a decreased resistance compared to a longer one is going to have an increase in resistance that's there. And so essentially this kind of comes down to, it's going to take more pressure to travel this distance than it is to travel this distance. And so just think about kind of if you were to throw a ball in a sense, or do anything of that nature, the more force that you give it, the further it's going to be able to go. The less force that's there, the less that it's going to be able to go. And so if we want it to go further and further along, say we were even throwing a paper airplane, there's more resistance in the air the further away that we want it to go. It's got to travel through the air a longer time, and so it's got to change that resistance that it's going up against. Versus if we just throw it a little bit of a distance, there's not much resistance there. The next thing that affects our resistance is the actual blood itself. And so the viscosity of the blood is a factor in this calculation of our resistance. And so the more viscous it is, the thicker the blood is, the more difficult it is to move the blood through it. So there's more resistance. Kind of think about this as the difference between drinking, say, milk versus a milkshake. If you're trying to drink it through a straw, the milkshake has more resistance going up through the straw than that of the milk. And so you have an increase in resistance because it's thicker. It's harder to get it to move through. You have to suck on the straw a lot harder, put more pressure there in order for it to come up through the straw with the milkshake versus just regular milk. So blood flow, as we look at it, is going to be equal to the change in the pressure divided by the resistance. And so as the change in pressure is between 2 points on a blood vessel. And so as we measure that change in pressure there, if the pressure is 100 millimeters of mercury here and it's 90 millimeters of mercury here, our change in pressure equals 10. And so we have a change in pressure that is there. And then we divide that by the resistance that is found within the blood vessels themselves. Resistance in and of itself is a relatively difficult thing to calculate within the blood vessels themselves. We can calculate the pressure change fairly easily, as we can see a change in pressure between 2 points on the body themselves, but that resistance factor there is a little bit more difficult to kind of figure out in a sense. So as we look at the blood vessels themselves, and we start to look at the changes that are there within the vessels themselves, we can see that there is a difference between one type of a blood vessel and the next. And so arteries themselves tend to have a relatively large diameter, especially our larger diameters. They are going to have a relatively smaller lumen. So the vessels themselves are much bigger that is there, because inside there we have a much larger amount of muscle. So there's a large amount of smooth muscle that's inside there. We also have a large amount of elastic tissue. And so they are going to have some spring back to them. They are elastic. And so as we go from having a blood vessel that is 1 diameter, and then we start to fill it with blood, as blood is passing through it, it's going to stretch out. And it's going to change that diameter. But the elasticity of the vessel is going to want to draw it back in. And we're going to utilize that fact in order to allow us to have this blood go into the vessels and have this kind of large bolus of blood empty into the vessels. And then that's going to allow us to transmit the blood along. And so as that blood stretches out the vessel at the leading edge and it starts to stretch it out, it eventually starts to go through its elasticity and start to come back down to a normal diameter, and that helps to propel the blood along. And so that's moving the blood towards the areas of lower pressure. And it's always going from an increased pressure towards a decreased pressure. So from a high to low pressure once it's there. In addition, this is essentially what we're going to feel as a pulse. And so that bolus of blood and essentially that stretching out of the vessels, this is what we can palpate on the surface of our body as a pulse that is there. The vessels themselves act in a sense as a bit of a pressure reservoir. And so the elastic walls themselves provide force to move blood along the way. And so as I said, as we kind of expand it out, it's kind of like blowing up a balloon a little bit and then letting some of that air back out. And so we're stretching it out, we're allowing that elasticity to continue to propel the blood along as we're then getting ready for the next contraction of the heart. As the ventricles are filling and they're not contracting at that time, our pressure has gone from a process where we've allowed it to essentially come up and then come back down. But we don't have a contraction the entire time. So after the initial contraction itself is over, the elasticity of the blood vessels is what's going to propel us along until the next contraction occurs. At that point there, somewhere like that. I don't quite have the drawing there done quite the way that it should be. Something like that along the lines there. And so we're going to have this change in blood pressure as it goes through the vessels from heartbeat to heartbeat. And so as the heart contracts, that stretches out those blood vessels. Those blood vessels have been stretched out, and now they're ready to help to propel the blood through the blood vessels themselves. And so here we have a low blood pressure. Here we now have a high blood pressure as we're moving through those vessels themselves. And then we move over to heart is now relaxing and filling, and now all of that elasticity can squeeze back in and push on that blood vessel and help to push the blood along. It can't go backwards because of the valve. And so the valve there is stopping the blood from flowing backwards, and as it does so, it only has one direction that it can move, and so it moves along through the arteries towards the capillaries. So when we look at blood pressure itself, we essentially have two concepts to think about. And so we have what we call systolic pressure, and then we have diastolic pressure. And so systolic pressure is going to be the higher of the two numbers. And so if we were kind of looking at our average normal, this would be 120 millimeters of mercury, and this would be 80 millimeters of mercury, as we look at the two pressures themselves. So systolic is as our blood vessels are filling with fluid because the ventricles are contracting. So our pressure is on its way up. Diastolic pressure, our pressure has already gone up, and now it's starting to fall back to the minimum number. Once it gets back down to that 80 again, then the heart will contract and it'll come back up. And so we'll have that change there within the pressure and bring us back up in pressure again, and then it'll come back down, and then again, and so on. And we'll keep on changing that pressure, always going from a diastolic to a systolic. Systolic being the higher of the two pressures. Diastolic pressure is the pressure essentially only being exerted on the artery walls during that time where essentially blood is continuing to move on simply because of the elasticity in the blood vessels as well as the change in pressure. And so we have a higher pressure near the heart and a lower pressure over in the venous side. The arterioles are the smallest of our arteries on the artery side of the system. And so these arteries themselves have a lot less elastic tissue in them, so they're less elastic. They do have more smooth muscle in them, so these are going to be having a larger amount of smooth muscle within them, which means that we can change the vessel diameter quite a bit. And so active vasoconstriction and vasodilation is going to occur in the arterioles. And so when we have contraction of that smooth muscle, we're going to say that we have vasoconstriction. When we have relaxation, we're going to say we have vasodilation. And so the vessels themselves can change the size of the overall vessel themselves. And so we can go from, in a sense, kind of rest to vasoconstriction. And we can go from rest to vasodilation. This is going to cause an increase in blood pressure. This is going to cause a decrease in blood pressure, primarily because we're going to change resistance. And so resistance is going to be altered by that change in diameter itself. We've gone from essentially the nice wide open hallway to a very constricted hallway themselves. It's also not just a hallway, but you can think of it as being kind of like exiting a room or exiting a hall or something like that. You were just at a concert and now everybody's trying to exit at the same time. It takes a lot longer for everybody to get out than it did, in a sense, for them to get in, because they're not all trying at the same time. The individual person was able to come into the venue a lot faster than they are able to get out, because it may take the exact same amount of time. It may have taken everybody, say, an hour to come in, but it was a few people at a time. But now all those people want to get out, and it's going to take an hour to get out again, but everybody's trying to do it at the same time. There's a lot more resistance to the flow of leaving the hall itself. So vessels themselves are going to change their diameter at any given time. And so here we have a normal arterial tone to the vessels themselves. This is kind of our baseline. This is a process where it's kind of halfway between vasoconstriction, halfway between vasodilation. And then we have the ability, when we need to increase blood pressure, to go into a vasoconstriction, or if we need to decrease blood pressure because one of the other factors of blood pressure has, say, increased, we want to go through vasodilation to try and decrease the overall pressure that we have at that particular time. Locally in tissues, We can have changes that alter that vessel diameter. And so we can have things that are going on within the local tissues there that are going to require a change in the diameter of our vessels, or the change in the radius of the vessels themselves. So if, say, a muscle starts to contract and it's working, this is going to lead to oxygen levels decreasing, carbon dioxide levels elevating, and that in turn is going to cause a local dilation of arterioles. And so inside that given muscle, we're going to have this dilation of the blood vessels that's going to increase our blood flow into the muscle. And then that also increases oxygen, decreases CO2, increases carbohydrates coming into the muscle in the form of glucose, things like that. So we now have the ability to power that muscle once again for a longer period of time. In addition, we can also have local changes that occur because of specific chemical modulators. And so we have these vasoactive chemicals. We have specific chemicals that can cause dilation and also constriction. And so these are going to relate back to our hormones that are involved in the processes themselves of controlling blood pressure. Some of this is going to be coming from our neurotransmitters themselves. And so we have our sympathetic nervous system for things like this. And so we have sympathetic stimulation is going to increase our vasoconstriction, increase blood pressure, things like that. So that's going to allow for that. So norepinephrine going to bind to alpha-1 receptors on smooth muscle in the majority of our blood vessels, and that's going to cause our vasoconstriction. So we have our sympathetics kicking in, causing this to occur. Norepinephrine can also bind to beta-2 receptors on smooth muscle, and this is going to go to places like our heart and skeletal muscle, and that's going to cause a vasodilation. So in times of sympathetics, we want an increase in blood flow to the skeletal muscle, an increase in blood flow to the heart, but in other places we want a decrease. So in places like the digestive tract, kidneys, skin, we're going to typically have a vasoconstriction. We're going to pull that blood away from those particular areas. So when it comes to the sympathetic nervous system, all we're simply doing is either turning up or turning down the stimulation. And so it's not, in a sense, a one versus the other. Remember that the blood vessels themselves typically only have a sympathetic innervation, and that is it. On the hormone side of things, we have things like angiotensin II. This is going to cause vasoconstriction. This is going to help us in terms of regulating the blood pressure. We have things like aldosterone. All hormonal things we're going to talk about when we get into the endocrine system. So this is going to be coming soon to the class itself, and we'll start to talk about the endocrine system in further detail as far as other hormones that can help in this hormonal control as well. So we saw this when we started to talk about the cardiac output. And so depending upon the needs of the individual tissues, we have the ability to alter the blood flow into those particular areas. And so if we have, in the case here where muscles are becoming active during exercise, we have the ability to change the amount of flow that is going into particular areas of the body. In this case, during exercise, we're going to increase it into skeletal muscle. In the case of, say, rest and digest, we're going to be doing going into the digestive tract, and our digestive tract numbers, rather than going down, would go up. We're going to change those numbers and make those changes there within the systems themselves. And as we continue to look on, we'll start to look into our capillaries and our blood flow into the venous side as well in the next video.